So, are you on the other end of the spectrum of womanhood? It's not the end, it's just a transition. So, we will talk about perimenopause and menopause. Some women go through this stage at about 45 years, some go through at 50, some a little bit later. But the general age group of perimenopause or menopause is between 45 to 55 years. There are some women, unfortunately, develop some of these symptoms quite early. That is labeled as premature ovarian insufficiency. Some of the women undergo this in an artificial manner, as in a surgical or post-chemotherapy or radiotherapy. But there can be other reasons why a woman can go through menopause. Now remember, menopause is a clinical diagnosis. So if you would like to discuss more about this, please speak to your own healthcare professional, or you can visit us at www.athenawomensclinic.com.au to make an appointment to see me. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. So you're more than welcome to see me. So, what is menopause? So it's just a transition in a woman's life where the ovaries are exhausted now, so they don't produce the hormones that they used to produce as normal during the reproductive years. What happens because of that? Most common symptoms: hot flushes, night sweats. The next, brain fog. Sometimes there can be psychological symptoms like irritability, fatigue, tiredness, crying for no reason, and just being constantly irritable. Sometimes you can have skin dryness or vaginal mucosal dryness, or you may struggle with urinary incontinence. So this whole group of symptoms is what comprise menopause. Now, a woman may experience one or all symptoms. So depending on what symptoms you experience, either we can diagnose and treat just that particular symptom that is giving you grief, or if there's multiple symptoms, then we go out and advise depending on your needs whether you're suitable to have hormone replacement therapy or not. There has been a lot of misconception about the hormone replacement therapy or menopausal hormone therapy because of the WHI study, but those myths have been debunked. But as always, please speak to your healthcare professional before you embark on that journey. It is important that you still maintain your nutrition, your fitness, your general health before you consider these options for you. So make sure you get your evaluation done for your general health, including your bloods, for your vitamins, and the pap smear or cervical screening has to be up to date, and also breast examination or breast health check. General advice according to Australian government would be to have a mammogram from at least once in 2 years. That's the recommendation, and I'd encourage you to follow the recommendation, although there's lots of videos that are going around on Instagram and YouTube about what a mammogram can do to you. So I would leave that with you to make your own judgment. Once you have found out if you are struggling with these symptoms and you've been diagnosed with menopause, then the options of treatment opens up, and like I said before, it's up to you how you want to treat your symptoms. And there are different modes of administration, as in it can be in the form of tablets, it can be in the form of a gel, or it can be in the form of a contraceptive coil but used for endometrial protection. So this is a general guide for menopause. I would not recommend that you strictly adhere to this. Please speak to your own healthcare professional to discuss your options further as to what may be the most suitable option for you. Don't forget to maintain your general health and fitness by eating healthy and continuing to exercise. There is no excuse for exercise. If you are struggling specifically with psychological symptoms that could be part of menopause, it is difficult to differentiate the two, but there are again options whether you treat only the psychological symptoms or whether you treat the menopause, then you may see that there is significant improvement in your own psychological health. Generally, there is no need to get any hormone blood test to confirm that you're menopause. Menopause is a clinical diagnosis, so please remember that. There may be some special occasions where we may have to do the blood test, but usually it is a clinical diagnosis. A woman is considered in menopause after 12 months of the last period. That it's a retrospective diagnosis, so it's really important that you guys understand that and not rush into getting some blood test saying I'm in perimenopause or menopause, because there can be symptoms. Your hormone levels could be normal, your hormone levels could be abnormal, but you could be completely asymptomatic. So both are possible, and that's why this is a clinical diagnosis. So good luck with this journey. Like I said to you before, if you need further help, we are available at www.athenawomensclinic.com.au, and you can listen and share this video from our YouTube channel as well. All the best.